Louisiana's capital city, Baton Rouge, with a population of over 800,000 and growing, is a major medical research and industrial center of the American South. This is the home of Our Lady of the Lake Regional Medical Center, with some of the top specialists in the country, 7,000 employees, a busy trauma center, a large physician group network, and one of the fastest growing children's hospitals with dedicated resources to meet the unique needs of young patients throughout the state and the southern U.S. Now, a behind-the-scenes look into Our Lady of the Lake Children's Hospital to meet the men and women who are devoting their talents, passions, and time to the care of the children. This is Louisiana Med.
Here today to take care of Carly Taylor. She's a 15-year-old young lady with scoliosis. And so our goal today is to do what's called a spinal fusion. And Carly came to me with a progressive scoliosis, so a fairly large curve in her back.
When I would walk a long time, I would notice a lot of back pain at school, carrying my book sack.
We went in for a yearly checkup at her pediatrician, and they were doing a physical on her, and when she bent over, he noticed that her shoulders were not level. And he said, I really think she has scoliosis. He said, I would like to, for y'all to go see a pediatric orthopedic doctor.
Treatment of scoliosis is often non-surgical. When it is a surgical problem, it often involves a spinal fusion procedure, and that involves making an incision on the child's back, moving the muscles out of the way and exposing the bones, and then grabbing anchor points onto those bones. And those anchor points are the screws that we use or the hooks that we use. That allows us to gently manipulate the spine into an improved balanced position. And then once it's in that improved position, the rods are connected to those screws or hooks to hold it in that balanced position while it fuses in that new position.
We decided on doing the surgery after we looked at the x-rays. The x-rays were horrible. I didn't see how she was walking around and being mobile from the way her spine was so crooked. And, I asked if she could wear a brace or do something else to fix it, and basically surgery was the only option.
Scoliosis surgery can be helpful in balancing the spine for long-term from the standpoint of cosmesis and function. So curves that are approaching 90 degrees can cause concern for heart or lung functional abnormalities. When you get up to 70, 80, 90 degree curves, it can be disfiguring and can affect children and adolescents' self-esteem. We're set up for a spinal fusion today. It's a surgery that takes about 6 hours to do.
We do pediatric hematology oncology for children at the St. Jude Affiliate Clinic.
I had my outfit though. Well, I'm Imani. I go to Brownsfield Elementary. I'm in the 4th grade gifted. Some of my blood cells are kind of like the crescent moon shape, and they can get stuck on other blood cells, which can make me sick.
She has a sickle cell disease. We moved here when she was 1, and then we became a patient of St. Jude's for the last, going on 9 years now.
You can come on out. Well, you grew 3 centimeters. Yay! Yay!
They just gonna stick to port, prepare for tomorrow. Then we come back tomorrow after they did filter the blood and everything. Right. Then they'll do the transfusion, which normally takes 3.5 hours, 3.5 to 4 hours.
The sickle cell is very much like any other red cell until it delivers the oxygen to the tissues. And when it gets deoxygenated and does its job, then the hemoglobins tend to stack on top of themselves and cause the red cell membrane, the coating, to get mad and get sick. And so ultimately, the red cell membrane stays in a peculiar shape rather than bounces back into its donut size. The etiology is that capillaries get plugged up with these fixed sickle cells, and then the oxygen can't be delivered to the tissue. You gonna get access today?
Yes.
What does that mean?
I'm gonna get my needle.
You're gonna get a needle put in your
Port and out.
and got blood work done. And show me where your port is.
Boom. Wait.
A port is a way that you can access the vein without me poking you all the time, right? Yeah. Okay. Be a good girl. Now go get your blood work done. You begin to chronically transfuse them to hopefully make their blood look like it's not a sickle cell blood, like we're giving them other people's blood so that they don't make their own S in their own bone marrow, and then they're more likely to be saved from having a stroke.
I like to come here because it's one of the closest places, and I get to be taken care of.
She will continue to come to clinic. If she's a child that down the road looks like she needs to be transfused through adulthood, then we have adult hematologists who they transition to, and they will continue her care as an adult. But that doesn't mean that she can't go to college. That doesn't mean she can't be a nurse or a doctor or a teacher.
I want to be a nurse because I want to help people. It's fun, it feels good to be able to help somebody else. And when you're kind, everything kind of plays out nicely.
So Imani can do anything her little heart desires.
Hello. I'm Dr. Stout. I'm one of the supervising doctors.
How you doing?
Nice to
I'm
meet you.
Parisha.
Nice to meet you. And Trent? All right. Can you tell me a little bit about what's going on? What brought you into the emergency department today?
My chest, had a chest pain at school this morning.
Okay. Trent is a 13-year-old boy that came in from school via ambulance for chest pain. Apparently he had sudden onset of chest pain while in class today, and basically, concerned, and the school called EMS and brought him in to be evaluated here.
I was nervous, so I didn't know what to expect when she said he was gonna call 911. I didn't know how serious it was.
Coming up on Louisiana Med, find out the results of Trent's heart tests during his visit to the region's only dedicated 24/7 pediatric emergency room. Plus,
I remember I was really nervous the morning of the surgery.
learn more about Carly's surgery for scoliosis.
Is it possible to look up to someone who barely reaches your knee? Can someone who can't speak leave you speechless? Kids are amazing, which is why at Our Lady of the Lake Children's Hospital, we're doing amazing things for them. From operating the area's only 24-hour pediatric ER to prescribing a little fun and games every now and then. Our Lady of the Lake Children's Hospital, the relentless pursuit of better.
I'm here today because we have an otherwise healthy young lady with scoliosis, and she's having surgery today.
Now we're taking this probe and painting the surface of the bone, and that helps us match the patient's anatomy to the CT scan and lets the computer know exactly where the spine is three-dimensionally in space.
She frequently complained of back pain. The x-rays were horrible. I didn't see how she was walking around and being mobile from the way her spine was so crooked. And basically surgery was the only option because it was so bad. They started about 6 in the morning and the surgery took close to 6 hours.
After a scoliosis surgery, the hospital stay is on average 3 days. They're typically in the ICU for 1 night and then in a floor room where family can stay with them for an additional couple nights.
I remember I was really nervous the morning of the surgery. I went in there and, I was still smiling. Everybody was like, I don't know many people that will be smiling right before they're having surgery, but I looked at it the positive way, like it's gonna be better after it happens. So, You know, I couldn't complain, but that minute that they gave me the anesthesia, that's when I started to get nervous, and I was like, this is it. You know, it's gonna be totally different after this.
This is day 19 that we've been here. Hattie is 3 years old. She was born in May. She has a twin sister. We found out when I was 18 weeks pregnant that she had spina bifida. All right. Take your blood pressure this morning. 5. Give her 5. Hattie was having some trouble breathing and she turned blue at home. That was the first time she had ever done that. And so we live in Ponchatoula. We had her checked out and then we came over this way because all of her doctors are Lady of the Lake doctors.
We're a children's hospital within a big hospital. And we have 100 beds, just about 100 beds. We have a PICU, so a pediatric intensive care unit, and trained by specialists that have really only deal with kids. Our PICU doctors are in-house, which means that they stay overnight in the hospital, and they're available day or night, any minute, to take care of the kids if they have difficulty while they're hospitalized with us.
We were in the PICU for most of our stay. We just got moved into a room on the floor. There's Dr. Joseph.
Let's see how this young lady's doing. I love her bow.
Uh-huh.
Did she pick it out or was it done for her? Hetty is a 3-year-old. She has a child with a form of spina bifida that's somewhat more complicated than some of the cases. Like many diseases, there's a spectrum of severity, and she's had a number of special problems that have required surgery and then repeat operations, and that's why she's here now, doing very well.
Oh, you keep losing your headdress, sister.
The most dramatic abnormality is the weakness in her legs and her ability to walk.
Her brother is 5, and then her twin sister, and they are phenomenal with her. They, just like any other kids, they run around the house. She, at home, she generally army crawls. So she's on the floor a lot, army crawling, and they chase each other through the house, her in her wheelchair and them running after her. And so they like to play Legos and dress up. Y'all play superheroes all the time? Yeah, so Harrison recruits us for superheroes.
In this disease, it involves not only the lower part of the spine in the nervous system, but in other less obvious ways, the brain, a condition called hydrocephalus, which in Hattie's case has been much of her problem. The way the hydrocephalus is managed is to drain the extra fluid that's made but not absorbed well by the brain into another part of her body. Fortunately, with all the help here, the ICU people and the resources in the operating room and radiology, we were able to deal with that problem, figure it out, and she's making great progress.
Can you give him a high five? Good job.
God bless you.
This is an emergency room staffed by ER-trained physicians that are specialty care in pediatrics.
We're now a 20-bed unit, including 1 trauma bay, so technically 21 beds. 2 of those rooms, one of which we're standing in, are resuscitation rooms, so the sickest kids come to these 2 rooms. We are able to see anything from fevers and runny noses to kids who are actively having seizures, who've been in car wrecks, or who've suffered great injury.
So we have some results back, and your chest x-ray looks good, everything looks normal on it, and your EKG looks good as well, everything looks normal. Yeah, so nothing going on as far as, right now we can see problems with the heart, or problems with the lungs like pneumonia or like an air pocket or anything like that. So how are you feeling?
Good.
How's your pain?
It's gone.
Gone now? Good, okay. So I think at this point we can send you guys home.
Okay.
If the pain recurs, you can always come back here, but definitely we'd recommend following up with the pediatrician by the end of the week just to make sure things look okay.
Okay.
And then, again, certainly if the pain comes back real bad, anything like that, come back in. We'll take another look at you. Yes, sir. All right?
Okay.
All right. Do you guys have any questions?
No, sir.
Nothing? Give us a few minutes. We'll have you on your way.
Okay, thank you.
You're welcome. With any child with chest pain, we always want to make sure there isn't a problem with the heart or the lungs going on. So we did obtain an EKG and a chest x-ray, both of which were normal, and gave him some ibuprofen, and his pain seemed to improve. He's pain-free now, and he'll be going home to follow up with his pediatrician.
What we do in pediatrics is we establish a relationship with our patients, and usually we start a relationship when the baby is born. So we actually see the babies at birth, and we follow them all the way through to anywhere from 18 to 21. What we do, once we get through those initial immunizations through the first 2 years of life, we usually see the children yearly, and part of that is to monitor growth. So we're responsible for their care, not only maintaining and watching their growth and development, but also giving them their immunizations, and we are there for them if they get sick or they have an injury.
When new families are picking a pediatrician, I think it's important that they find someone that they're comfortable with. It's a unique situation where a whole team of people are coming to take care of this new baby. The parents, the family, the doctor. A lot of times it is so important for people to realize that even though your children aren't small anymore, it's still really important to maintain a close relationship with your pediatrician. A lot of people ask me, well, when do I outgrow the pediatrician? And I say, not until college. Most of the time we are trained and enjoy seeing our patients grow up. And there's lots of stuff that we need to take care of and anticipate as they get older.
Coming up, a wish come true for a 5-year-old who triumphs over cancer. Plus, hear more about Carly's recovery after scoliosis surgery. You're watching Louisiana Med.
Ever find yourself following in the footsteps of someone whose feet are half your size? Can eyes that look the same as yours make you see things differently? Kids are amazing, which is why at Our Lady of the Lake Children's Hospital, we're doing amazing things for them. From being able to treat the most critical pediatric conditions to offering patients pet therapy during their stay. Our Lady of the Lake Children's Hospital, the relentless pursuit of better.
Did their order say pulling packing like every 2 hours?
They'll finish pulling packing tomorrow.
Our Lady of the Lake is an academic medical center, and Our Lady of the Lake Children's Hospital has in particular built around academics, meaning education and research around children, and teaching physicians, young physicians, how to take care of children, and actually how to think about children and the care of children on a bigger scale. Pediatric residents are in the Children's Hospital, and they take care of kids in every clinical setting. That's the emergency room, that's the intensive care units, and our pediatric inpatient service. They also get exposure on our outpatient service. They work in teams, so they may be working with physicians who are more experienced. We call them faculty, and it's the faculty's role to kind of help the residents learn about the medical knowledge of taking care of patients, but also some of the more subtle things, kind of the art of medicine that we talk about, how to do a good job of taking care of patients, making families feel comfortable, and thinking about how our patients are cared for in the community.
Eat your babies.
Her name's Sky Nicole Crockett. She's 3 years old. She was born with a chromosome abnormality, a heart defect called coarctation of the aorta, hypotonia. She has a weakened immune system. This is her second time having pneumonia, but this is the worst that she's had. And so we decided to take her to the emergency room at St. Francis in Monroe. They had to intubate her and transfer her here because they didn't have the staff and equipment to keep watch on her like they did here. So that's how we ended up here. They airlifted her.
I'm a pediatric hospitalist at St. Francis Medical Center in Monroe, Louisiana. We have a very good relationship with the pediatric intensivist and the specialist at Our Lady of the Lake Hospital. We rely on them to take care of kids that are critically ill. When you have a child that's critically ill, it's very stressful for the family, and it really puts us at ease to know that, that expert care is readily available with just a phone call.
We started a pediatric transport team over 2 years ago. We will go out and get children from other facilities. The transport team works in conjunction with the intensive care doctor, so that intensive care doctor is speaking with the physician at the outside hospital and really directing the care of that child even before the child reaches our center.
It's vitally important for all of the hospitals in Louisiana to work together to provide care for kids. If we can coordinate care with other hospitals, we can provide care much more efficiently and safely and make it a good experience for the parents and the kids. And it really helps with the coordination of care if we all work together.
She was perfectly fine Thursday, and then Friday evening she got a cough, and then Saturday she was in the emergency room. She's actually doing really good. She's almost completely off of her oxygen. The only thing that's really keeping her here is getting her to eat. So once she's able to eat on her own, or actually eat anything, then she should be able to go home. But she's always been a fighter. From day one, she has fought, and that's the whole reason she's here.
Hey! Okay. What's going on?
Our Lady of Lake Children's Hospital, our hematology oncology department, is an affiliate with St. Jude Research Center. So we're one of just a few hospitals that have this designation as an affiliate of St. Jude. Our outpatient heme clinic is actually called St. Jude's Clinic. And what that means for us is that we get to capitalize on all the research and expertise that's done at St. Jude, and we can share that knowledge and patient care with our patients here in Baton Rouge.
Oh, good to see you. You look so pretty. Lily is a 5-year-old precious little girl who came to us with a diagnosis of lymphoma and also went to St. Jude for her initial staging and decision-making as far as what type of chemotherapy regimen that she would be on. Then she came back to us, thankfully, because we enjoyed her for an 8-week-long treatment course, which was pretty short, and she was an amazing, amazing little warrior during that time. You growing something up there?
Oh, yeah. Some fuzzies for sure. Yeah. Starting to stick out on the sides.
Oh, it's so good to see you. You feeling good?
Mm-hmm. All right. Well, today we're here to have a 3-month checkup for Lily. She was diagnosed with Hodgkin's lymphoma back in August. We noticed that she had a lump on the side of her neck right here. It was almost the size of like a grape. And so we went to our pediatrician and they referred us to an ENT. He decided to do a biopsy. So from there, when they biopsy the tissue sample, they found that it was the cancer.
What's under that hat? Do you have hair? Yes, you have hair.
They did all her PET scan and everything and showed that she was cancer-free after her treatment. And so we're here to get a checkup, so everything looks good so far.
At the end of treatment, we have to celebrate. We have to finish with a big celebration. And the first thing out of Lily's mouth was, I would like to ride a unicorn. The day of her no more chemo, we had started our party here. Lily had cake and gifts. And after we finished with all the festivities with her family here in our waiting room at the clinic, we went downstairs and outside was Willow, a unicorn, waiting for Lily to have a seat and ride. It was phenomenal. It was a great experience just to see the look on her face, and I think everyone that was able to attend could appreciate how she felt in that moment.
Even now, I'll still look at her as she's growing her hair back. I'm just like, my daughter had cancer, and it just still doesn't seem real, even though we've gone through the process of chemotherapy and she's in remission, and just it still doesn't seem real.
You know, we're here to help and we're here to facilitate, but really they're the true champions in all of this, and it's really inspiring for us grown-ups to see how well these kids do during treatment. They just, you know, battle it out.
We have a young lady with scoliosis, and she's having surgery today. The first day after surgery, we have them get up and walk with physical therapy, so they're walking the halls. We encourage that. We want them to do that. For the first 6 weeks, we really restrict any repetitive bending, lifting, or twisting. And so we say no BLT, no bending, lifting, or twisting repetitively. And then the fusion part of the procedure, even though the spine is balanced in a new, improved position, the screws and the hooks and the rods are holding them in that position until the spine fuses, and that fusion takes about 6 months. So for 6 months, contact sports and those types of things are restricted, and after 6 months, there's really no restrictions. She'll notice, she'll probably be a little bit taller. She will notice less disfiguring, so to speak, of the chest and abdomen area from improved balance of the spine. When she stands, she's more well-centered head over pelvis when she stands. Her shoulders are more level, her hips are level. I think there's a renewed sense of confidence or self-esteem with that.
I used to have a problem with like going out to parties with my friends and stuff because I was just always like so crooked. And I guess I felt weird, but after my surgery, I was so glad when I could like look in the mirror and see myself just straightened up, and that was like the best thing ever.